So over the next 20 minutes, we'll be exploring this topic. You know, stress is an inevitable part of life, especially in a fast-paced society like Singapore, right? But we put in so much focus on controlling our blood pressure, controlling our blood sugar, controlling our blood cholesterol, so that we can protect our heart. Turns out, stress is an independent risk factor for heart disease, which means that if you didn't have any of the, as they say, 三高, so high blood pressure, diabetes, cholesterol, and you were very, very stressed, the stress itself can actually damage your heart. So in this talk today, we will explore how stress can actually increase your risk of heart disease. So this is an overview of what I'll be going through today. I'll be talking about what stress is, what are some of the common triggers or stresses, what are some of the signs and symptoms in our body, how do we know we're stressed in terms of our feelings, our experiences, our thoughts perhaps. We'll talk about why stress is actually a good thing in the fight or flight response. But when stress becomes too pervasive in chronic stress, how that can lead to inflammation, nerve and hormone activation, and that can affect your heart and increase the risk of heart disease. At its extreme, stress can actually lead to broken heart syndrome, which can mimic a heart attack. So what is stress? I'm sure many of us have, at some point in our lives, felt a bit like this climber here, hanging by the edge of the cliff, or at the bottom of the cliff and looking up, feeling I'm so small compared to this huge mountain. When we feel that we're smaller than our challenges ahead of us, that leads to a demand-resource mismatch that can, but not always, can trigger a stress response. So you feel that the problem is bigger than yourself, you feel a sense of lack of control, and you may feel stressed. But even if you have control of the situation, it is plausible that you don't know why you're in this situation, and that lack of meaning may actually induce stress. For instance, this man might be wondering, why am I even trying to climb this insurmountable mountain in the first place? This leads to stress, which is a body's reaction of feeling threatened or under pressure. And it also is described by the World Health Organization as a state of worry or tension caused by a difficult situation. So it's one thing to feel stress, but what are some of the triggers in society? It might not project as well, but according to this recently published Straits Times article, 1 in 3 workers in Singapore actually report feeling stress or burnout at work, according to Ministry of Manpower data. It's real that at the workplace, work situations, or the work itself, it can most definitely lead to stress and burnout. The PSLE has been touted as the most important exam in your life. And this documentary by CNA Asia details how students and their parents can feel very stressed by the PSLE or other exams. Those of you who invest in stocks and shares may find this chart very stress-inducing, with all the red arrows going down and stock market crash. Turns out, this has actually been studied. This group from China looked at 8 million heart-related hospital admissions and found that when the Shanghai Composite Index and the Shenzhen Composite Index actually increased for the better at its extremes or decreased for the worse at its extremes, the rate of hospital admissions for heart conditions actually increased. So it's not just when the composite index decreases, but when it has extreme changes, extreme emotion is induced, and that can actually lead to heart problems needing to go to hospital. Day-to-day financial matters can also lead to stress on individuals and families. It can increase risk, the research has shown, of diabetes, high blood pressure, high blood cholesterol, heart disease, and stroke. And the noise around us, known as noise pollution, sometimes from transport as well, can induce inflammation, high blood pressure, and increased risk of heart disease. So it's important to know that the same trigger can cause a lot of stress in one person, but it may not cause that much stress in another person. So please always be mindful of the amount of stress that you may be experiencing or actually reacting or giving as a reaction to the trigger in front of you. And our next few talks will be able to help us mediate that response. If your body senses a threat and you feel stressed, the sympathetic nervous system goes into overdrive. You can get stomach problems, headaches, unusual pains, skin reactions like rashes or hives. You may feel dizzy, sick, or faint. You may actually even get high blood pressure, which is measurable, or chest pains. But please remember that when the stress goes away, and if you're still experiencing these symptoms, then you should get your heart checked out. Stress can affect our emotions, so we may feel irritable, angry, tearful, worried, anxious, hopeless, or scared. Sometimes it makes us feel like we're frozen in time, and we may find it difficult to make decisions. Or the other way the other extreme can happen as well, and we're actually in overdrive, we have racing thoughts, and we feel overwhelmed. Stress, though, is it really such a bad thing? Because if it's so bad, then how come we've evolved to have stress? So it turns out it's a very primitive response that comes about to protect us in the fight or flight response. It's a survival mechanism that enables speedy reaction to threatening encounters, such as in the caveman days when we encountered a lion and we had to either fight the lion or run away. The amygdala is a part of the brain that controls emotional processing. So when your brain sees a threat, the amygdala will send a distress signal to the hypothalamus, which is another part of the brain that acts as the command center. The hypothalamus will then trigger nerves to help you breathe faster, help your heart beat faster, and make your eyesight sharper so that you can run away or fight any potential threats. So in this sense, acute stress is a good thing. It helps us to counter the threat in front of us. Chronic stress, however, might indeed be your heart's worst enemy. This is an article that was published in the New York Times and then shared on the Straits Times website. This article details research that has been done recently that has demonstrated that stress is an independent risk factor for heart disease and may in fact cause even more damage on your heart than the traditional heart risk factors. So people will say, yeah, I know chronic stress, affects your behavior, so it can indirectly cause heart disease, right? Well, that's true. When you're stressed, you may smoke more, you may, reach out for comfort foods that may not be as healthy, you may feel not as motivated to exercise, and when you're stressed, your blood pressure goes up. So all of this leads to high blood pressure. Smoking is bad for your blood vessels. It can cause diabetes as well as high blood cholesterol. And then all of these factors will then affect your heart. When one is stressed as well, if the stress is unchecked for too long, it can lead to depression and anxiety. And depression is interesting because it's got a two-way relationship with heart disease. People who are depressed, unfortunately, are at higher risk of getting heart disease. And people who have developed heart disease then are at higher risk of developing depression. And when you're stressed, it's difficult to sleep well. The sleep then causes inflammation and high blood pressure, and that can lead to stress. So we think we understand, right, that stress can indirectly cause heart disease. Latest research has shown that the stress can directly hurt your heart through these very complex mechanisms. Essentially, the stress that you perceive will trigger your brain, your adrenal glands, your bone marrow. It can actually also affect your immune system, and it can affect the production of white cells in your body. Stress, therefore, is an independent risk factor for heart disease, and the complex mechanisms that underlie it in your body include this physiological response of the HPA axis, so the brain and your hormonal response. It can cause, as we know and discuss, behavioral changes. It can affect your metabolism. It can make you feel more heightened and less able to relax. It can increase the production of white cells, which can increase inflammation. And it can also affect your immunity. Ever wonder why, when you're stressed, you tend to fall sick more easily? Well, that's because the stress through these pathways can actually affect your immune system to fight viruses. So, to reiterate how stress can directly hurt your heart, when the stress triggers the brain then causes the adrenal glands, which are above our kidneys, to secrete steroids. And the steroids then can lead to weight gain, high blood pressure, and diabetes. Stress also triggers the nerves, and then the nerves will stimulate blood vessels to tighten, cause high blood pressure. The nerves will also trigger our adrenal glands to secrete more adrenaline, and it builds into a vicious cycle where the adrenaline then causes the blood vessels to tighten even further. Stress will stimulate the bone marrow, and the bone marrow will give off a lot of chemicals that will increase inflammation. Inflammation is bad because it can hurt your blood vessels, not just in your heart, but also in your brain and in your kidneys and the rest of your body. When there's increased inflammation, there will be atherosclerosis, which is the buildup of cholesterol in your blood vessels. And increased inflammation also makes it easier to form blood clots. And so you can imagine if your blood vessels are narrow with cholesterol in there and there's lots of blood clots that are easier to form, that can increase your risk of having a heart attack. So at its extreme, stress can actually cause this entity called broken heart syndrome. There are other names for it, such as stress cardiomyopathy, Takotsubo cardiomyopathy, and apical ballooning syndrome. It was named after the Japanese fisherman's pot to actually capture the octopus. I turned this octopus upside down, but you can imagine that a pot that has that shape would be similar to a heart that's having Takotsubo cardiomyopathy or broken heart syndrome. So it's triggered by stressful situations and extreme emotions, but anything in its extreme, so extreme illness or surgery. The good news is that for most people, they recover fully. Some people may not have full recovery and they end up feeling weak from a weakened heart function. People who have broken heart syndrome can have symptoms very similar to a heart attack. Actually, for us cardiologists, it's difficult to know if they're having a heart attack or an episode of Takotsubo until we actually take them for surgery and do an angiogram. So the symptoms of broken heart syndrome can include chest pain, breathlessness, sweatiness, almost identical to a heart attack. The ECG that they have done in emergency can also be very identical to a heart attack. Why it happens? Well, when there's a trigger and we can't control our body's response to the trigger as well, the stress hormones then surge, in particular adrenaline, and then it causes some part of the heart to stun, so it doesn't work as well, causing this ballooning like an octopus pot. Risk factors for the broken heart syndrome, well, anyone, if they're stressed enough, can lead to their hearts being broken. Some risk factors include, gender. Perhaps females may be more predisposed, persons over the age of 50, and also people who have, mental health conditions that may feel very stressed from these conditions already. So, don't stress. There is hope on the horizon. So, in this study by this group in the US, they looked at 150 people with heart disease. And the 150 people were then matched with another group. The three groups, in the group that did not receive any cardiac rehabilitation or stress management, so they just basically lived with their heart disease as best as they could, at the 5-year mark, 70% of them have unfortunately had another heart event. Then they looked at the group where they gave cardiac rehab exercise. So they were given specialized supervised exercise training for their heart disease. And at the 5-year mark, only about 60% were free from clinical events, so 40% of them had a heart event. The group that had both cardiac rehab, exercise therapy, and stress management training actually did the best, because at the 5-year mark, 80% of them were free from repeat heart disease, with only 20% of them suffering a repeat heart attack. So this study demonstrates that if we were to exercise, we'll do better for our heart. If we were to exercise and manage our stress, we'll do even better for our heart. So in summary, we've discussed what stress is and some common triggers. We've talked about the signs and symptoms of stress that our body can emit when it is stressed. We talked about the fight or flight syndrome mechanism being a good stress response. And we've talked about how chronic stress can lead to inflammation, immune activation, and then heart disease. And at its extreme, it can literally break your heart. So I'm very pleased now to be able to move on to our next two talks that will teach us how we can get better sleep, reduce inflammation, reduce our blood pressure, and how we can manage our stress better, especially since in a fast-paced society like Singapore, triggers can be everywhere, but we can take control of that and manage our stress. Thank you very much.